So, good afternoon, everyone, and welcome. I'm Andrea Ais, a regional hub lead from the European region, and I'm delighted to be your moderator for today's session of the Planetary Health webinar series. Thank you all for joining us from different countries and backgrounds to discuss a topic that is increasingly becoming important for the future of both healthcare and our planet. The role of the sustainable health systems and the leadership of nurses and midwives in addressing climate change and environmental challenges. As healthcare professionals, we witness this every day how environmental changes affect the health and well-being of our patients and community. So today's webinar brings together inspiring speakers from around the world who will share their experiences, expertise, and initiatives in planetary health. We hope this session will not provide only valuable knowledge, but also inspire practical actions that participants can take within their organizations and communities. Thank you once again for being here. With this, it's my pleasure to introduce our first speaker, Harriet Nayiya from Milcott, Uganda, who will be speaking about acting as catalyst of change. Harriet, the floor is yours. Are you here?
Andrea, I don't think she's been able to join yet.
Okay, so let's begin with Lucy Brown from the Center for Sustainable Healthcare.
Thank you, Andrea, and a very warm welcome to everyone who's joining us online and to my fellow speakers and panelists. So I've got the wonderful opportunity to talk about educating the future. So looking at how we're revising the code within the nursing within the UK, the Nursing Midwifery Council, and how we're looking at educating and putting sustainability into the nursing midwifery curriculum, as well as courses that we're running at the Centre for Sustainable Healthcare. Can you all hear me okay? Just checking it's not a delay or anything. Great stuff, good stuff. I'm just going to share my screen. So as Andrea said, I'm the Development Director at the Centre for Sustainable Healthcare. I'm also a Fellow at the Health Sciences University as well, and have written a book on sustainable nursing with Elsevier, which should be out later this year, which should be very useful for all of you. And all proceeds from the editor and author will be going back to the Centre for Sustainable Healthcare. It's a bit of a cycle, a bit of a circular economy there that it'll be investing in more education for nurses and midwives. So I'm just going to quickly share my screen and I'll go into my presentation. If I can get a thumbs up from one of my colleagues if they can see it. Oh, I think Harriet's just joined us, so I'll pass back to Harriet in a moment. Great. Okay, a little bit slow today. And welcome everybody who's joining us as well. I can have a thumbs up from my colleagues if they can see. Thanks, William. Can you see the screen?
I think it's loading.
Slow today. Great. Okay. About the other about me is I'm going to talk about planetary health professional standards and system leadership, but actually how nursing
Lucy, I think you might have frozen.
Oh no. Okay. What I might do is, am I back again? Great stuff. Okay, just double checking.
We can't see your screen though. I can't anyway. I don't know if anyone else can.
Okay. What I might do.
It's here.
That's great. Just a little bit slow. Okay, great stuff. Okay. So the UK bandwidth isn't very good today. So I'm here to talk about nursing midwifery and how it can really shape a fairer and low carbon future. So I've got a few slides, and I was going to start off with just talking about sustainable healthcare, because we do talk about it in lots of different guises: planetary health, climate care, etc. So just moving on to my next slide. So sustainable healthcare really is about everything. It envelops everything that we do. And I really like the definition for the United Nations, which talks about the ability to provide healthcare to meet the needs of the present without compromising the health of future generations. Now, putting that simply, we are consuming it at an alarming rate across our planet, and we're using finite resources that will run out. And unfortunately, future generations won't have access to healthcare like we once, but like we fortunately do have, particularly across Europe. And what's really interesting, and sounds so obvious to everybody when I say it, is that our health and the health of our planet are intrinsically linked. Without our people and planetary health support one another, it's the air that we breathe, the water that we drink, the food that we eat, the soil that our food is grown in, all impacts on our health. And so as nurses and midwives, we really need to understand that, embed that into our practice. I'm just moving on to the next slide. Okay. So what are nurses and midwives? So I love this study from Ipsos Mori, and obviously it makes us look great, but nurses and midwives play an incredible part in improving population health. We are the most trusted profession on the planet year on year, as by this study by Ipsos Mori proves. People listen to us. We have duty of care along with our code of practice to really make sure that we're educating our patients and their families to take good care of themselves, but also the planet as well. And they understand the impacts of the climate crisis and biodiversity loss on their health and the health of their communities. And we have a real obligation to that. And that's where the code comes in. So within the UK, those of you that don't work within the United Kingdom, we have the Nursing and Midwifery Council, which governs us as a body, governs us as a nursing and midwifery profession, making sure that we work in the right way and regulates us and supports us. Now, the NMC code, as it's known, the Code of Conduct, is currently under review after 10 years. And it's a real professional turning point for us within the UK, because actually it's a real opportunity to look at exploring how we embed sustainable value throughout our code, throughout our proficiency standards, throughout our education and our revalidation, which is how we ensure that we stay professionally capable through our careers. So every 3 years we have to revalidate. And actually through that we have an obligation to...
So sorry. Oh, so I'm so sorry, Lucy. We've lost your slides.
Oh, okay. I might just sign off quickly and sign back in, but if I hand it across to Harriet and I'll come back in a moment. Is that okay?
Absolutely, of course.
I think that might be the best answer. Okay, speak to you shortly.
Thanks, Lucy.
Hi, everyone. My name is Harriet Naiga. I am a midwife from Uganda. I'm the founding director of Midwife-Led Community Transformation, MILCOT, which is a community-based organization that brings midwifery services closer to the community through preventive initiatives. And we focus on prevention of teenage and unplanned pregnancies. Among other program areas, we have vocational skilling for marginalized adolescents and young adults. We have capacity building for nurses and midwives to ensure that they are skilled in provision of adolescent-friendly sexual and reproductive health services, as well as developing them as leaders so that they can become really community champions in health. And then we also have social enterprise programs. I am also a champion of Nursing Now Challenge. I always say that I have been with Nursing Now Challenge ever since it was established to raise the status and profile of nurses and midwives. So I'm one of the beneficiaries, and as well as a partner, having implemented some programs with Nursing Now Challenge, especially developing leadership for nurses and midwives. So in my work at Millcourt, we also have Millcourt General Clinic where I'm working as full-time midwife and as a director of Millcourt. And Millcourt General Clinic was established in partnership with Vaca Health Foundation. And these international collaborations are really helping us to tackle the local problems as well as global problems. So while doing my work as a midwife, especially at Millcourt General Clinic and in the community, working with adolescents, I realized that the challenge of climate change is really affecting people and the people we live with as midwives in the community. And I also noticed that marginalized adolescents and young adults are affected more because these are the members of the informal sector, meaning they tend to experience challenges, but they really do not know where the challenges arise from. It means that the people who have the idea, like us, who have the skills, are the ones to support the communities mitigate these challenges. And this leads me to the challenge of plastic bags in communities, just as part of the climate challenges that we have. So we have a challenge of plastics, and while I noticed that we have a lot of plastic bags being littered in the environment almost everywhere in my country. And it's not only in my country, but most of the developing countries. People use plastics and they litter them everywhere. And we know that they have a lot of impact that they press on the environment. For my case, especially in Kampala, the capital of Uganda, you will find that plastics always block the drainage systems, especially when it rains. And we see a lot of flooding in the city. And when we see a lot of flooding, it means we are going to have waterborne diseases. We are going to have people being displaced. And these are the marginalized communities. They get displaced. It disrupts their businesses. And the diseases that people always suffer from, they end up coming to us. So I treat women with babies coming in with diarrheal diseases, with malaria. And we have seen a lot of cardiovascular diseases that are caused by climate impacts. So us, as midwives, as nurses, I realized that we are so much on the front line of care for the people who are suffering consequences of climate change. It means we are the best advocates of climate action. But then when I look around, like nurses and midwives are nowhere to be seen. I mean, those ones who are doing good work in climate action, perhaps we haven't seen them enough. And those ones who do not have the knowledge and information and the skills, I thought that this is the time that we start empowering nurses and midwives so that they can get involved in climate action. First of all, to get to know about it, as well as coming up with different innovations or even advocating for the patients, because we are the ones who are in adequate position to do that. I hence thought it wise to partner with Nursing Now Challenge and these other very, very, very significant partners, Center for Sustainable Healthcare and Alliance of Nurses for Health Environment. So this is what we are doing, and today we are welcoming this session from Europe. We have done with Africa, we have done with Americas, and now Europe. So we really welcome you, and we are looking forward to hearing from you because this is a significant issue that needs collaboration, global collaboration, so that governments can hear us. And also just to know that nurses and midwives are the best buy to be supported in this fight, so that we can help governments tackle climate change and we save our populations. Thank you very much for this opportunity. I'm looking forward to hearing from you. Let me end here and give you time to share with us what you have.
Thank you, Harriet, for your speech. It was really inspiring. And then let's go back to Lucy and let's see if we can hear you, Lucy.
I hope so. And I'm so sorry, everybody. Apologies. We all have
Don't
technical
worry.
difficulties sometimes. But anyway, I'm back now, which is the main thing. So I'm just going to share my screen again. Please do let me know. I've definitely got a faster connection now. Can you see my screen, everybody? Could I have a thumbs up? Thank you very much, David. Right, we'll get started. We'll start from the beginning, if that's okay with everybody. So I'm Lucy Brown. Lovely to meet you all. I'm the Development Director of the Centre for Sustainable Healthcare, and we are really proud to be sponsoring and supporting a partner on these brilliant webinars. And it's Europe's opportunity now, as Harriet kindly said, for us to share and showcase the work that we're doing. So my presentation over the next 10 minutes or so, we're looking at how we're educating the future and what we're doing within the United Kingdom, but also the Centre for Sustainable Healthcare as our offering from an education perspective for all global nurses and midwives. So I'm going to start off, I know you had a little bit about it just now, but just for completeness, I'll run through the entirety of my presentation. So I always start off my presentations with a bit kind of a frame around what sustainable healthcare is. And this is an adaptation for the United Nations definition, which is it's the ability to provide healthcare to meet the needs of the present without compromising the health of future generations. Now, as we all know, we can't continue consuming in the way that we are, and particularly in healthcare. I think we've all had busy shifts. We've seen the amount and volumes of equipment and materials that we use. We need to start looking at working more sustainably and using our resources in a more sustainable way, reusables like we did many, many years ago. And then the second part, which I want you to use to frame your thinking over this next hour or so, is understanding that our health and the environment are intrinsically linked. And we as nurses and midwives have to act in a way that supports both people and planetary health. And we're in a very unique position to do that because we have huge influence over the populations and communities that we serve. There's a lot more information there from the Planetary Health Alliance. I've got lots of links to resources for you to read. Obviously 10 minutes is a big topic to cover in 10 minutes, but lots of CPD for you all to learn lots more. So I'm just going to quickly frame your thinking a little bit further before I go into a bit more detail. But we can clearly see from this study, linked there at the bottom from the Lancet back in 2025, how climate action, the co-health benefits of climate action, from there reducing our carbon emissions, which would go across the graph, which is quite busy, across to reducing social and health inequality. Now, there was a really lovely example of this only just this week within London in the United Kingdom, where the London Mayor introduced an ultra-low emission zone within central London. Now, there was a really sad case of a young girl called Ella who sadly passed away from air pollution. She was the first person within the United Kingdom to have air pollution on a death certificate, and arguably globally. And it actually acted as a catalyst for the Clean Air Fund to look at reviewing, and obviously the government or the mayor within London, to introducing these low emission zones within London. Now, a study came out in the last couple of weeks demonstrating that, and this is such a wonderful outcome from such a sad story, that the lung capacity of children within London has grown as a result of the introduction of the ULEZ zone. So you can see quite clearly here the healthcare benefits related to climate action. So I would really urge you to read that paper, but I just always include that in just to help. Now, why nurses and midwives? Well, I'm a nurse, a very, very proud nurse, and I really, truly believe we need drastic action. We need a catalyst for change across the globe. And who better to lead that change than nurses and midwives? Year on year, Ipsos Mori have well documented that nurses and midwives are the most trusted profession on the planet. We can influence the choices and decisions that all of the population and communities we serve make, educating them, which is part of the code of practice and code of conduct within the UK. We have an obligation to educate our patients on taking care of themselves and making sure that they stay healthy and well. And that feeds in beautifully to sustainable healthcare. So I hope that's framed your thinking. And I truly, truly believe that nurses and midwives will step up. After all, we care about the planet, we care about people. So the NMC, so for those of you that aren't based within the United Kingdom, the Nursing and Midwifery Council Code of Practice is our regulator that makes sure that we're practicing safely, that we're putting patients at the forefront of everything we do, and making sure that we work as effectively as we can, making sure we're proficient as nurses and midwives. Now, the NMC is currently reviewing the code after 10 years. So you can imagine there's quite a lot of change over those last 10 years, particularly within the sustainable healthcare area. And what they're looking to do and exploring as a group, and myself, we're very fortunate, and Emma Blakey, Dr. Emma Blakey is also on this call, sit with on the committee reviewing the code. And what we hope to see is that sustainable practice is embedded across all of the professional and education standards, because it's intrinsically linked to patient safety, to the quality of care that we provide, and patient outcomes. Obviously, with the code as well, it will support us to guide us. There'll be practical advice of how to embed that, but also how we can influence, as I've spoken about already, to make sure there's clear links and we can create a culture where it links people, planet, and care together. Now, sustainable value, if you're not familiar with that term, I could do a whole webinar on that on its own, but there's links at the CSH. But sustainable value looks at the outcomes for patients and populations, but takes into consideration the environmental impact of that care, the social impact, and the financial impact. Now, more often than not, we're kind of I hate to say across our health systems, we're always looking at the economic benefit of the care that we provide or looking at budgets. But actually, this lovely sustainable value looks at it as a holistic approach, making sure that patients are at the centre of the care that we provide, but also thinking about the environmental impact as well and the social impact. So more on that. So the NMC, as I said, is at a turning point, and it's critical that nurses are uniquely placed to influence populations, as I've already said, but we play a critical role in mitigating, but also adapting. Unfortunately, we know that mitigation alone is not enough, and we need to adapt to the changing climate. Across Europe alone over this summer, we've seen deadly heat waves, which have impacted on our patient care. So what we really need to look at are some key areas, and I would urge this across all codes of practice, is recognition of climate change as a health risk. The significant impact it has on population health, patient safety, and service delivery. There's been examples in acute care organisations where they have had to close wards because they're too hot, they can't maintain a safe temperature, or that staff have found it difficult to make clinical decisions because of the heat is kind of impairing their cognitive function as well. As well as that, it's looking at environmental impact within patient-centred decision-making. So how do we need to consider that in safety and value? And then also back to the kind of earlier slide I had, linking climate action with health equity. Sadly, those that are from lower socioeconomic backgrounds will have the most impact from a health perspective in inequalities. It's disproportionate, and those from vulnerable populations will be most impacted by environmental harm. And we have to pull together as communities to support those individuals and those communities too. We need to strengthen the prevention-focused approach to care. The new model looking at community-based care, keeping people at home and keeping them well, is the pillar, the cornerstone of sustainable clinical practice. And that's what we need to look at across the code of practice and how we look after our patients. But also that sustainable leadership is a professional expectation as well. I've talked about resource stewardship, looking at system improvement, embedding it within quality improvement as well, all the time looking at how we can improve the care that we provide for our patients. And the expectations of competence, making sure that we keep up to date on what's happening across from a sustainability perspective, thinking about the skills and behaviours we need to educate and practice safely and lead those teams and lead those individuals that we work with and the patients we work with. So that's just a bit of an area there. So sustainability, how do we embed it into the nursing and midwifery curriculum? So fairly obvious, one lesson will create awareness. So today, coming to this webinar will raise your awareness if you aren't aware, but looking at how we can repeatedly apply this so it becomes a professional capability. So at first we need to understand planetary health, climate justice and healthcare impact, but we have to apply those cases clinically. So there's been so much great evidence out there on case studies that have already been applied to practice that basically other organisations across Europe, across the globe, can take forward and embed within their practice. We don't want to reinvent the wheel. We don't want to keep doing things again and again. But actually, how do we truly collaborate and share improvement projects for all to benefit from? And I've talked briefly about SUSQI, so sustainable quality improvement, making sure that you measure any innovation or any research we do, looking at that triple bottom line that I've just discussed. And then finally, demonstrating through assessment, through practice portfolios and reflective learning and CPD, how do we share that learning and keep learning and keep sharing that for everybody to benefit? So looking at kind of education standards and how nurses can benefit. Oh, just trying to get along. There we are. What do nurses and midwives need to do? Now, this is just a very high level kind of looking at nurse curriculum and what could be included in, and I know a lot of universities across the UK are embedding this now, but actually nurses and midwives need to be able to explain how climate change, biodiversity loss and population and resource depletion is impacting on human health and our health systems that we work within. We need to recognise these climate-related risks. I've already spoken about extreme heat, which is quite uncommon within the United Kingdom, but also poor air quality that I've touched on, but also flooding. We saw unprecedented floods at the beginning of this year, certainly within the south of England, which impacted the ability for people to get to work, the infrastructure, but also once the floods had receded, it gave exposure to patients and to staff to pathogens that we weren't ordinarily kind of exposed to. So thinking about infectious disease that comes with this flooding and extreme weather. Also looking at applying the principles of sustainable clinical practice. Again, this is a whole principle behind, but I'd urge you to read the paper there from Francis Mortimer on the sustainable physician, which talks about those 4 principles that can really make a difference, and think about how we use our resources. Using our resources responsibly, thinking about every single decision we make in practice around which medicines we use, what equipment we use, energy, water, all of those things. How can we use reusable products? All of that needs to be embedded within the clinical decision making for nurses and midwives. And how do we measure? It's really, really important to measure the impact that we have and we make. So looking at understanding basic carbon footprinting, which goes hand in hand with kind of money that we save, but also more importantly, the health outcomes for our patients. And I guess the last 2 is really reflecting on practice, but being a true advocate for climate resilient, equitable and sustainable healthcare. We as nurses and midwives really need to lead this change. And I really believe that we can do that. So in summary, we need to educate all healthcare professionals, all nurses and midwives to change the system. So we all need to be able to recognise climate related risks. We need to redesign care, looking at prevention, as I've already spoken about, self-care, getting people to really look after themselves, patients and populations. We need to measure the outcomes so we can continually improve and demonstrate what we're doing. But also we need to lead change. And I call to all of you, no matter where you are in your career, we all need to lead the change across professional and organisational boundaries and share these case studies, share our learning so that we can all collaborate and act as a catalyst to embed the change we so desperately need to see. We need to really think about how sustainability is about quality of care, safety and leadership. It's not an additional add-on, it's not a tick box, it's not something that can be done overnight. It has to be embedded into every single decision making to ensure that we have a healthier future for all. Now, the good news is we've got access to some brilliant courses at the Centre for Sustainable Healthcare, which was kindly funded by the Burdett Trust for Nursing. So a big thank you to Claire Cable and the team there. And this model of care, so when we've looked at education around sustainable healthcare previously, we found that if you educate one level of nursing, they almost come across barriers. So you empower the frontline nurses, for instance, they get really charged up, full of energy, enthusiasm to lead change in sustainable healthcare. But actually they get blockers because their managers don't understand the importance of how they need to lead that change and look at embedding sustainable practice. And then also you need to look at it from systemic changes. How do you ensure you've got these enabling infrastructures so you can influence and adapt and lead change at scale across organisations and across systems? So this course was designed in this way to make sure that every single level of nursing and midwifery across any organisation can lead the change, but also it reduces the amount of barriers and ensures that knowledge is turned into practical improvement, which is then in turn system leadership across collaborating across all the organisation. Now the good news is we've still got places on the programme, which is open to all global nurses and midwives and also student nurses too. So if any of you students are on the call today, please do access. We've got funding until the end of the year. The links are there for you and I'm sure that the presentation will be shared with you. please come and join us. You're very, very welcome. It is in English, I do apologise for that, but it's all online, accessible online, and we'd really love to welcome you all to come and join us and learn more and share with your colleagues too. So just a quick example of the impact that nurses and midwives can do, because I know we've got a really action-packed agenda, but nurses and midwives, when you give them the right tools to lead change, they have a significant impact. Behind this data that I'm sharing with you is 12 teams led by a nurse or a midwife, either in a ward or within a clinic basis, and they have a significant impact because as nurses and midwives, let's be honest, we can see the waste in the system. We know exactly where we can reduce our carbon footprint through making sensible decisions and sensible choices. So let's equip ourselves with the knowledge and educate ourselves so that we can lead that change and measure this brilliant impact. There's links there to the reports there for you to learn more, and please use those case studies to embed within your organisations. The idea is that we're collaborating and sharing knowledge for best practice. So just a quick last note from me, please do join us. We have a number of networks, 39 different networks across pretty much nearly every specialty. We've got dental, we've got surgical, OTs, everything you can believe, but come and join us and share the resources. All our resources are open access, thousands of case studies, as you can see from the slide there. Please come and join us and use, and let's work together, because ultimately it's up to us to save the world for tomorrow. It's up to you and me. And that's just a bit of a tribute to Jane Goodall, who died last year, who was a huge environmentalist, and he had a huge impact on me. So that's it from me. I hope that was useful. Apologies again for the earlier technical difficulties, but there's time for questions at the end as well. Back to you.
Thank you, Lucy. Thank you very much. Now it's a pleasure to welcome Willem Kees-Tilma and Susan Jansson, who will share their perspectives and experiences in research and innovation. So Willem and Susan, thank you for joining us, and the floor is yours.
Thank you so much for giving the opportunity to give a presentation here. Can you all hear me? Still? Yeah. I'm a former RCU intensive care nurse and currently work as a teacher and a researcher at the Amsterdam University of Applied Sciences. And I do research together with the intensive care at the hospital that's just beside our faculty. And I will talk with you about what we do with research and how you can apply that within clinical reasoning. I'm just seeing, so as Lucy just mentioned, climate change results also in more heat waves, flooding, and scarcity of food, an increase of respiratory diseases and cardiovascular diseases, and even mental stress. So the change we are now experiencing will result also in more and more people that need care. And we have to provide that care. And on the other hand, the way we provide care is also contributing to climate change. So if we want a healthy planet, we have to change our way of working. And we also need a healthy planet for ourselves. So the European Green Deal, they formulated 5 goals to work towards sustainable healthcare. And this is on a policy level, setting milestones in the future to see, okay, this is where we all have to work towards. So this is about promoting health, raising awareness and understanding, work to reduce your CO2 reduction, and work towards climate neutral care within a couple of years. But these are quite ambitious goals, and for clinicians and teachers and organizations, it is a challenge to really make the change to work to reach those goals. And this is where, what we are now working on. How can you see, or what steps can you make to introduce sustainability within daily care? And there are 4 aspects that I would like to share with you how we do that in Amsterdam. So the first one is about the R strategies. I will introduce them later to you, and integrating these strategies within clinical reasoning and evidence-based practice. And there is one possibility of really measuring the environmental impact of a product or a way of care. And the last one is to work together with other experts to see how you can redesign something you use in care or whatever. And this is where Suzanne will also take over the presentation. So the R strategies, these are 10 strategies to increase circularity and to make sure that the environmental impact of the thing that you are doing or buying or that you need becomes less. So what you see here is all different kind of steps, and the higher you are, so if you say, for example, R1 or R0, then it has the less impact. And this tool is being used in any kind of field to make a more sustainable choice. And what you can see is that, sometimes we think in Western countries that recycling, we're doing a really good job and recovery, but these two are actually far down in this ranging because, of course, it's good to do this, but the environmental impact is still quite high of what you recycle. A lot of energy is needed to recycle something, and mostly the quality of the product is not that good as it was afterwards. So if you want to reduce your environmental impact, it's far better to see if you can reuse materials or if you can repair or refurbish or maybe redesign something so it can be used in a different way or for multiple times. And in the upper box, that's more where you start seeing, do I really need this? Or can we rethink or can we look at our process of care in a different way that we do not need something new all the time or that we can reuse stuff? And I think in the Netherlands or where I did my training, we are used that everything is always available and that you can easily use something new all the time. But in other countries, this is not that, that's not always available. So, and I think that we need to raise awareness also that it's possible to use things several times and that you can, we have to change the way how we organize our work. And one of the things, the second thing that we can do is that you really apply evidence-based practice. So evidence-based practice is the best available science, your clinical expertise or expert opinions, but also what is available on materials and what are the preferences of the patient. And if we really look at a lot of, interventions that we apply in practice, it's important to check, is there really evidence and how strong is that evidence? And do we apply it because we think it might be effective, although there is no evidence for it? Or is there really a shown effect in large studies that you should do it for patient benefit or something? And in the Netherlands, we also have a list. It's called Better Do or Better Don't. And this list is, it's in Dutch, so it's not very useful to share it now with you, but it gives a lot of examples of nursing care that you better should or you better should not do. So applying this list, and it's based on evidence, it's something we teach our students now and that we talk about with colleagues. Okay, how can we change our project, or do we really need to do that? And this is also, of course, depending on the clinical context of what is available and, how do you talk with each other as colleagues? What are you used to do? or what are you willing to let go, or do you really need to do that? So in the ICU, we apply the R strategies, and we had a look at our process of care. What are things that we really need to do, and what are things that we can maybe let go? And nebulization in invasively ventilated patients is something that used to be done 4 times a day in every patient, no matter what. There was a strong belief that this was really beneficial for the length of stay in an ICU, and people thought we really had to do that to keep the tube or to keep the endotracheal tube open. But we did a large trial, and we showed that actually, if there is no specific indication like pneumonia or tough mucus, there is no need to do this 4 times a day. You can just leave it. So we now change the protocol, and we say, okay, we only do this when there is a strong indication, and otherwise we don't. And this is an example of rethinking your process of care based on evidence. We reduce the amount of materials needed, and we also see that there is a reduction in environmental damage, because you do not need the medication, you do not need all the disposables to nebulize medication. But we know that people are stubborn, including myself. I'm also stubborn, but when we work together, you have these ideas and it's not easy to change your practice. So we realized that by doing a large study, you need to do more to really change practice within the Netherlands. So we developed a tool, and we call it Choosing Wisely. And in this tool, we really make it very practical. Okay, is there a pneumonia or is there a strong indication? Then you can use it, and otherwise don't use nebulization. Maybe use humidification or something else. And this tool is now being implemented in 5 ICUs, and we are also investigating the culture. So we have discussions with people. Why do you use the tool? Do you not use the tool? What do you think when you use it? And this is really interesting, because here you can share knowledge, but it's not only about sharing knowledge. It's also about having a discussion together, why you want to do something or why not, and what beliefs are there. And I think nurses are very strong. They have could have a strong influence on how we deliver care, but they're also in a hierarchical position. So this can sometimes be a challenge for people to stand up for what they think is valuable or what they think that needs to be done. So this is now, by doing these discussions with all the professionals, we are really setting up a new culture to do this together. So another thing that you can do is really measure what is the environmental impact of a product or some kind of care. And this is an analysis on 18 midpoint indicators that really specifies the environmental impact. And this could be ground materials or water and land use or particular matter or the CO2 emissions. Because sometimes we think environmental impact is only about CO2 emissions, but it's not. It can be very different. And some products are really having a high impact on water or land use, while the CO2 emissions could be lower. So this is why a life cycle assessment gives the information on all these indicators. And how do you do this? Well, it might seem easy, but it is actually quite a lot of work, and it's a lot of detail. But you have to gather all materials that's being used. You have to weigh them. You have to define what's the kind of material, how these are being transported. Sometimes you have specific detailed information of a supplier, and if not available, then you use, there is a big database of mean values for all kinds of products. And then you can use that one, and then you analyze everything in a software program like OpenLCA or CIMAPRO. But then in the end, you do get an impression on what the environmental impact is. So we did this, for example, for humidification. Inhaled air in the ICU is always humidified, but it can be humidified in two different ways. So it's either active, that's the device you see here underneath with the warming and heating of the water that before it is inhaled to the patient. And the other one is passive, and it's just a filter, and that keeps the moist that the patient is breathing out. And when you inhale, the air is taking the moist back into the lungs. And what we saw is that the filter is just having the equivalent of environmental impact of a half a kilometer drive in an average car. And the active humidification system is having the environmental impact of 127 kilometers driving with a car. So if you think that the filter can stay for 24 hours in a patient, and the active humidification has to be changed after 2 weeks, I mean, this is so much more impact that you can save. So, well, this is one thing that we did, and we are now designing also a study effect on clinical outcomes and see if we can make people more aware, do I really need this active humidification or not? And in another thing we do is endotracheal suctioning. This is also frequently applied in invasively ventilated patients, and it can be done by two systems. So it's an open system, which you see here on the picture, or a closed system that stays connected to the endotracheal tube. And we thought, which one is more sustainable? Because while it's applied so many times, it's just once, but still it's all the gloves and the system by itself that you throw away. That's just what we do here in the West. And then we saw that if you use 6 times an open system, it's already more sustainable to use a closed system, because the closed system can stay there for 72 hours. So this is now what we changed in our protocols, that when we expect a longer duration of ventilation, then people are connected to a closed suctioning system. And then the last part that I would like to share with you is multidisciplinary collaboration. So this is working together with technical engineers, waste companies, biomedical technology, and ICU nurses or intensivists to look how can we redesign care and what are the chances for circular airway care. And I think this is where the real future is. It's difficult sometimes, but it's also inspiring, because they look at a total different way at how we provide our care, and they come with new ideas. And to have this discussion together, you can, really share your knowledge and also contribute to the care of the future. And this is something, to give an example, the filter I was just talking about, we were working together with students from technical engineering, and they were thinking, okay, maybe we can make it reusable, we can use a different filter, maybe this can be sterilized, and then you can use other filters within. So this is how an idea starts, and then you have to work on and see if there is enough possibility to really make the steps to do that. So concluding, sustainability in care, I think, is closer than you think, especially a tool like the 10R strategies can be easily applied. And I would suggest start with clinical reasoning in relation to the care you provide, and always open up to other experts to see if you can redesign the care that you provide. Thank you. And then I pass on my time to Suzanne.
Thank you, Willumke. I'm just gonna share my screen quickly. Can you see my screen already? Okay.
Yes.
That is good. Will it enlarge? That would be even greater. Hi everyone, my name is Suzanne Jansen. I'm a pediatric nurse at the Elmet Children's Hospital in Amsterdam. And next to my work as a nurse, I work in our innovation studio, which is called the Verbeterde Zorg Studio in Dutch. And if you translate it, it would roughly say the Improved Care Studio. I think the easiest way to describe myself is me being a nurse who would also like to make healthcare a little bit better, not by just giving care, but by making the care itself, by improving it. I believe that we nurses are in a unique position to do that. We see what works, but we also see the small frustrations, inefficiencies, and risks every single day. So why an innovation studio? Every day, healthcare professionals come up with ideas. What if we did this differently? Why are we still doing this way? Could we make something safer? Could we maybe use less material? But often people don't have the time, knowledge, resources, or the network to turn that idea into an actual solution. That is where our innovation studio comes in. Our role is to bridge the gap between a clinical problem and a practical solution. We help healthcare professionals move from an idea to an actual prototype, test it in practice, learn from it, and when it works, help it move towards implementation. So the most important thing about our approach is that we start with the problem and not really the technology. A nurse, doctor, or other healthcare professional brings us a problem from their daily practice. Together, we investigate what it really is that is the problem, what's really happening, and what the underlying need is. Then we work on possible solutions. We prototype quickly. We work together with students, specifically technical students. Then we test the prototype in the clinical environment and continuously improve the solution based on what we learn, and we keep improving it until it's something that we can actually work with in practice. Sustainability is increasingly becoming part of that conversation. We do not only ask, does this make care better, but we also ask, can we make care better while using fewer resources and creating less waste? Innovation is a team sport. We don't believe that nurses have to solve everything themselves. I, for myself, know that I don't have the time to do that. Innovation is a team sport. We bring together people with completely different perspectives. Nurses and other healthcare professionals bring the clinical problem and practical expertise. Students bring fresh perspectives and creativity. Designers and engineers help us turn ideas into physical solutions. Researchers help us validate the impact of our work. External partners can help us develop and scale solutions, and families and patients can help us understand better what it is that they need. The nurse doesn't have to be the engineer, designer, and the researcher, but the nurse can be the person who says, there's a problem here, let's do something about it. I have two examples for you. This is the first. It's reducing glove waste. I think something that everybody that uses a lot of gloves will recognize and has the ability to have a lot of gloves around. We use a lot of disposable gloves. At least here in Amsterdam UMC, there are thousands and thousands of gloves used every day. We noticed that they were often taken from dispensers with a big hole in them, or at least the hole where the glove box is in was so big and the gloves stick to each other that a lot of gloves are being pulled out at once, making it very wasteful and having a lot of gloves falling on the ground and not being able to be used anymore. So what we designed was an inlay for the glove dispenser so that when you would now pull out a glove, it would actually be one glove and not multiple ones. We did some clinical testing, and eventually we found that there was a 50% reduction of gloves falling out, or 52% less gloves were being used, which is great because it does not only mean that Nurses don't have to pick up all kinds of gloves from the ground, but it's a huge reduction of waste or products being used. Example number 2 is the thorax clip, how we call it. It's a completely different problem. You might know thorax tubes that are used in patients who need drainage from the chest. One of the risks is that the tube can become displaced or dislodged. For us, this creates a safety risk, and it can also mean additional interventions for the patient. So a nurse brought this problem to our studio. We worked together to redesign the way that the tube could be secured. The result was a new clip. And with that, we were able to reduce the risk of dislocation. Again, the solution itself is relatively simple, but the process behind it is important. It was a clinical problem identified by a nurse, translated into a design challenge, developed collaboratively, and tested in practice. What does this all have to do with planetary health? I think sustainability shouldn't be something we add to healthcare afterwards. It should become part of how we design healthcare in the first place. When we develop a new solution, we can ask, is it better for the patient? Is it better for the healthcare professional? And increasingly, is it better for our planet? The glove dispenser is a very tangible example. Fewer gloves means less material, less waste, and potentially fewer resources used throughout the supply chain. But the bigger lesson is that sustainability and quality improvement don't have to compete. Sometimes the same innovation can make care safer, easier, cheaper, and more sustainable at the same time. So I would like to hand out an invitation to all of you, because we sometimes think innovation requires a big research team, a large budget, or revolutionary technology, but many innovations start much smaller. They start with someone saying, this doesn't make sense, there must be a better way. Nurses are in a unique position to do that because we experience healthcare from the inside every day. So I believe we should give us nurses the time, space, skills, and networks to turn those observations into actions, because improving healthcare doesn't always start with a big invention. Sometimes it starts with a small problem, a curious nurse, and the willingness to try something different. If we can make healthcare better for our patients and better for our planet along the way, that's an innovation worth pursuing. And to finish it all with some strong words, us nurses don't just deliver healthcare, we can redesign it. Thank you.
Thank you both for your excellent presentations. We will now turn our attention to a broader policy landscape. I'm delighted to welcome Emma Blakey, NHS England Sustainability Fellow, who will share key developments, lessons learned, and opportunities for nursing and midwives leadership. Emma, over to you.
Hello, good afternoon, everybody. I think a colleague, thank you so much for sharing my slides. It is so wonderful to be here with you all today. My name is Emma, like Andrea said, and I'm the lead nurse for sustainability within the National Nursing Directorate at NHS England. So currently, NHS England leads one of the world's largest publicly funded healthcare systems, the NHS, and my role really focuses on helping nurses and midwives to deliver high quality, sustainable and climate resilient care now and in the future. And I work with my colleague Ria Khan, clinical sustainability nurse specialist, who I believe is with us today as well. So next slide, please. So colleagues have already mentioned this very important point, but climate change is not simply an environmental issue. It influences many of the things that determine health and our ability to deliver health and social care. And one of the most important things to understand about climate change is that its impacts are not experienced equally. So we really view climate change as a risk multiplier, magnifying existing health and social inequalities. For example, families living in deprivation are more likely to be exposed to air pollution or poor housing, overheating and flooding. Next slide, please. So in 2020, there was quite a big international event happening at the time, but that was also the year that the NHS became the first health system in the world to commit to becoming net zero. This wasn't just about carbon targets, it was also a response to this growing evidence that we've just talked about, that climate change is already harming health and increasing pressure on our health and care services. So within the NHS, we have 2 legally backed targets to reach net zero for different parts of our emissions. But it's important, I think, to note that this is not just an ambition. Now, 5 years on, more than 5 years on, we can see that real progress has already been made. So we have NHS emissions 68% lower than in 1990 and a 14% reduction in just the last 5 years. We're on track with our interim targets despite complexities and challenges in the system. And you can see this diagram on the right of the slide shows where most of the NHS emissions come from, with the largest contributions in medicines, prescribing, supply chain, estates, energy use, and travel. That helps colleagues across all of the NHS focus on their action and where to kind of try and make the biggest difference. But I think one of the big points we want to reinforce is that lower carbon healthcare isn't just good for the planet, it also supports better population health, helps reduce health inequalities, saves money, and can make our services more resilient to the extreme weather. So this is something that if we go to the next slide, we can see that climate change is a recognised public health issue. The net zero ambitions are reinforced in our NHS's sort of 10-year plan, so this sort of strategic look into the future. And we have global and national recognition that addressing climate change, addressing and driving the net zero ambitions, and focusing on climate resilience is legitimate nursing work. And if we move to the next slide, the way we frame that within our team is we look at this environmental sustainability as a public health priority, legitimate nursing work, and not a burden or extra responsibility, but actually something that's already part of and aligned with the professional priorities that we have for our practice, for our research, for our strategic thinking, because actually this is all about creating high quality, healthier systems for the benefit of people and communities now and into the future. So this is nursing work, and this is all about health. So if we look at the different domains on this little star, we can see, and I know that Lucy, you've already mentioned this, and colleagues before will be, and before me and after me will be talking about this as well. But this is about quality, safety, future readiness, resilience, public health, but also that patient, community, and staff experience and well-being, and really addressing inequalities through transformation and sort of improvement efforts. We know that climate action generates many co-benefits for health, and we know that advocating for prevention, public health, and effectiveness also generates co-benefits for the environment. So we are looking at this sort of win-win situation. So we've seen environmental considerations embedded into nursing work. We've seen this in care homes. So this image you can see here of a community garden of green space. We saw some fantastic examples of this in some care homes in the Midlands. So it's the middle part of England. Residents there were spending time outside, working in the garden, leading the way with care home staff supporting them. Specific nature-based activities, for example, staff got to know residents better, more effectively, and could identify clinical deterioration in a timely manner. So by dealing with these health issues early, we can prevent more complex care being required, and it's much better for residents themselves and their families. And the care homes themselves were really interested in the resilient side as well, looking at shade, looking at solar panels, so really looking at that whole system. Next slide, please. So how are Ria and I doing this work? How are we trying to do this work? We're a very small team. We work nationally. We are 2 people, like I said, and it's a real privilege to be in this role. Some of the values we hold is that we're open, we're collaborative, we focus on equity. And I think there's something very symbolic that a nursing directorate has these roles embedded within it, and something I personally would love to see in other places, other teams, other countries. We are small, but I think that we could say that our influence is starting to really have some reach. We're seeing effects in across the board in policy and education, quality improvement, clinical practice, procurement, research, public health, and professional leadership. And I have the privilege of working with many of colleagues that are on the call today. Some of the things we do are more invisible or less obviously visible. So when we look at things like that strategic leadership, so really trying to influence and inform a range of different policies. We held a roundtable this year, bringing together senior leaders, and we can already start to see some of the ripple effects of that, where we've, the influence in that has been brought into other things, such as university settings or teams focused on mental health or children and young people. And as Lucy mentioned, the work around the nursing and midwifery code. Some of our work is more visible. So we do a lot of work with our national network with nearly 800 members, very much part of that relational leadership and that practical leadership. And it's a place where people can develop confidence and capability to lead change and translate ideas into practical improvements for patient care. And our evaluations year on year show that there is that connection. Ultimately, we believe this network helps to turn that individual expertise into collective professional impact across the country and beyond. Next slide, please. Some reflections from me then is that we're very much always learning and thinking about our leadership and thinking about our impact and work. We've put a lot of effort into being of service, providing quality subject matter expertise, combating that misinformation and disinformation that often can exist around issues like climate change and sustainability. Really, we believe in connecting people and building those trusted relationships with a focus on collaboration, learning, and thinking in systems. So I think that's really enabled us to connect climate change in healthcare delivery, influence practice through that ripple effect and sometimes more directly as well, and support that transformation and improvement across the nursing directorate, but also across different teams that work in hospitals and care homes and different clinical places. I see us as a bit of a bridge between that policy space and frontline care. If we go to the next slide, please. So I would say that if any of you here today have done any of the things that we've been talking about or that are on this list, you are already a planetary health leader, and I'm so happy to have you in our space, in our profession. Like I said, this is not something additional or extra to our nursing practice, but actually part of what we do to support high quality care now and into the future. And just onto my final slide, please do get in touch. Please do join us. We hope that you will join us at our network or through our drop-in sessions. And you can also send us an email. Thank you so much. Back over to you, Andrea.
Thank you very much, Emma. We will now broaden more the discussion further through an international lens. So join me in welcoming Raluca Radu, planetary health consultant and adjunct professor at the School of Nursing, University of British Columbia.
Hi, can you see my screen?
Yes, we can.
Okay, perfect. Thank you so much. Good afternoon, good morning, or good evening from wherever you're joining us. And thank you so much to the entire team for having me amongst this amazing panel of incredible nurses and midwives. I'm happy to share some of my experiences from British Columbia, Canada. Just a little bit of background about me. I am a nurse professional by training, a registered nurse that is, and I've spent the last 6 or so 7 years embedded within the climate and health space, and more recently with a role that wrapped up as this Providence Healthcare, which here in Vancouver is a healthcare institution that delivers care to British Columbians. And I was their first planetary health leader. So I was in charge of overseeing everything that had to do with strategy development, sustainability and quality improvement projects, and supporting the teams on the ground. And I'm hoping to speak more to that through some of the slides that I've prepared today. All right. So I just want to preface that in Canada, the healthcare system emissions are roughly around 4.6% of our total greenhouse gas emissions. And I have the privilege to work with a lot of incredible clinicians here in British Columbia who are leading on incredible projects when it comes to sustainability. And one of those clinicians is actually Dr. Andrea McNeil, who is a fantastic physician and a surgeon, and who, alongside other colleagues, have come up with essentially this framework that has essentially shaped how we plan our sustainability initiatives to ensure that not only do they reduce demand for health services, they match supply for health services to demand, as well as reduce emissions from supply of our health services altogether. And one thing that I wanted to preface is that back in 2021, British Columbia experienced three very substantial climate-related events that not only exacerbated and put a substantial burden on the healthcare workforce, which at the time was facing the COVID-19 pandemic, but has also had to deal with a disruption in the infrastructure and the facilities as a result of the atmospheric river, which essentially disrupted our ability to have access to essential medical supplies and equipment. We saw the hottest temperatures on record at the time in British Columbia, and within the span of a week alone, we saw about 700 people lose their lives. And of course, we know that these numbers are even growing higher now, as we've seen with the last extreme heat events that have happened over in Europe and the UK. We've also seen substantial wildfires back in 2021. And what I wanted to preface is that as a result of these events, there have been increasing efforts across the healthcare system to ensure that it is working towards adapting and building resilience so that the communities that are living across British Columbia receive the support and the care they require, even when such events happen. And as a result of that, almost all the health organizations across British Columbia have embedded planetary health and or climate change specific objectives within their organizational cultures and institutional roadmaps. And one of the ones that you see here is the Planetary Health Strategy by Providence Healthcare, which I have helped develop for the years of 2024, 2029. And I've had the privilege to work with all the colleagues who are belonging to the different health authorities listed here and who really are leading incredible work across this space. As a nurse in the position of planetary health lead, I think I had a very unique role in being able to bring that clinical expertise that I've gathered over the years, having worked in acute care hospitals here in the Lower Mainland, but also having brought my educational experiences from having taught at the University of British Columbia, where I led a climate and health course. So really thinking about those educational priorities and thinking about the on-the-ground realities that we're facing, my colleagues on the front lines. And so when we think about what can health professionals do to contribute to environmental sustainability, I took a moment to really reflect on these last years in these professional roles that I've had the privilege to have. And I think when we consider how we promote essentially behavioral change approaches and how we manage patients, but also how do we co-create those approaches together with them rather than doing to them, we have to be doing them with them in partnership, making sure that the public is educated about the impacts of climate change on their health. And that means through really strong advocacy and public health campaigns where especially I would say nurses and midwives should be front and center in leading them because they have the expertise to do so. Thinking about how in our practice settings, we're using local green spaces to promote health and well-being, considering what services are available in our own geographical area that can assist people to keep that active lifestyle and to really promote these in our practice, whether it's acute care or public health, engaging in that improvement of coordination between primary, secondary, and tertiary levels of care, which can really help patients ensure they receive timely access to healthcare before their condition deteriorates. And where applicable, of course, if there's the ability to engage with using telemedicine and e-health, we know that they can have a substantial impact on the public's well-being, but also that of the environment. Although I'm not able to capture the plethora of examples of incredible good work that is happening across British Columbia, I wanted to just showcase that, in BC, lots of green teams have come up and essentially from the Lower Mainland where I'm based all the way up into the northern part of this province, who are leading on projects from reducing patient belonging bags to ensuring that there's reusable metal spoons instead of the plastic ones, to recycling appropriately, blue wrap recycling, and also making sure that it's repurposed accordingly so that the safety and well-being of patients is not compromised. And there's a lot of examples that I'm happy to share if you want to get in touch afterwards. One other aspect that I was a part of, as I mentioned earlier, was that of capacity building. And again, because of my background in having taught at the university here, I was essentially engaged with the Ministry of Health in this case to support through an advisory role for this course that was recently launched for BC healthcare professionals. It's a course on climate change and health with a focus only on the BC context. So really taking into account the different geographies of this province from rural, remote to urban. And it's a course that's also split in two different modules. One that's more the foundational level, that's providing an overview to health professionals of all disciplines about what the realities of climate change are when it comes to healthcare settings. And then the more advanced, which they're open, of course, to take if they want to dive deeper in, where we get to delve into how to essentially lead on sustainability initiatives, how to contribute to resilience building, and essentially how to partake in advocacy and policy building at that institutional level. At the regional health authority level, we have worked with Cascades Canada, who I'm sure you've heard of, to essentially condense one of the courses that they offer on a regular basis to 30 minutes, a time that we all agreed across the healthcare system that was amenable to health professionals' workloads, especially, and also thinking about the different orientation modules that health professionals have to complete when they join a health authority. So this is currently embedded across British Columbia as an optional, for now, course that health professionals are invited to take to at least get a glimpse of how sustainable health systems work and also what their specific organization is doing to tackle that. On a more individual basis, and I apologize, I know I'm going fast through this, I'm just mindful of time. On an individual basis, while I was working as a planetary health leader at Providence Health, I was also a student of completing my quality academy and learning about quality improvement and how to essentially lead sustainability through a QI lens. And in part of my capstone project was essentially to deliver a series of workshops to different health professionals to build capacity and awareness about planetary health. And it was very evident from my first session to the last that this workshop played a huge role in not only building awareness across the board for the different disciplines that joined my session, but also helped to contribute to new staff joining the green team at Providence Healthcare, which was ultimately one of the key elements that I was looking forward to seeing in my evaluation study. One thing that I wanted to note as a key lesson from my time at Providence Healthcare is that community building activities are a fantastic way to strengthen the shared purpose towards achieving planetary health. Education and capacity building can move beyond the classroom, the traditional style classroom, the workshops that we can deliver online. And to essentially natural green spaces, as you can see in one of the images for Trees for Health, where we essentially came together to plant trees across health facilities. And that's a picture of myself and actually the CEO and Dr. Melissa Lem, who's an international physician who works on nature prescribing, and the sustainability fairs, which are a really phenomenal way to address sustainability in an institution by bringing together all the people who work alongside one another to essentially promote planetary health, and especially learning together with Indigenous peoples and from Indigenous peoples how to steward our resources and lands appropriately. In closing, although again, it was a lightning fast presentation, some of the things that come up time and time again, every time I have a different role, is that there are ways to engage in the space from the micro to the macro. So at the micro level, really thinking about how we are shifting our behaviors and helping our patients, our families, our colleagues to align with sustainable practices in day-to-day work or home life, ensuring that at the meso community level, we are building and sustaining that community of practice, and at the macro, really thinking about what can we do to advocate for policy change from the municipal to the national and an international. Thank you so much.
Thank you very much, Raluca. It was very interesting. And we move forward to our final speaker today, who is David Renard from Médecins Sans Frontières. So the floor is yours, David.
Yes, thank you very much. Can you see my screen?
Yes.
Yes, okay, very good, thank you. Perfect. So my name is David. Thank you for the invitation. It's great to be to this event, and I know some of you. It's a pleasure to be here. I'm working for Doctors Without Borders since 2012. My background is in ICU nursing, and I'm working now as Sustainable Medical Practice Advisor. So my role is to engage with our medical director or nurse, doctors, to see what are the opportunities to reduce our impact on the environment through pretty much reduce the amount of equipment we need to provide care. A little bit of background to tell you. So Médecins Sans Frontières, Doctors Without Borders, or MSF, it's a really big organization. It's there for around 50 years, 1971, a bit more. We have 5 big offices in Europe and 1 in Africa. And all of these offices have collaboration with other offices that do recruitment and fundraising. So it's a really big organization with around 50,000 staff, depending on the emergency or the moment, and around 10,000 beds in 75 different countries. And we do a lot of different activities, inpatient, outpatient, very different type of disease to be treated. But the key thing here is that these 75 countries, the projects where we work in, they are very, very, very vulnerable to climate change. And so for us, it was super important to take action, to take a stand, and show some leadership on these aspects. And so we declared a climate emergency in 2019, and we signed a pact in 2020 to include in our strategic plan carbon reduction objective. First, by measuring a footprint and then building a roadmap to decarbonize our activities. Quickly, the footprint numbers are not important, but what's good to see here is that half of the footprint comes from everything we buy, and a third comes from all the transport that we need, because we are very international as an organization. And we have the roadmap, as I mentioned before. Most of the solution come from the supply chain, but we see that medical practices are part of it, and that's where we're going to dig a little bit into detail today. So I'm coming back to the footprint. So the baseline 2019, we will dig into the goods that we buy, because as medical, to provide care, we need equipment. And what we've identified is that 2/3 of the equipment we need to provide care is of single use. But what single use do we need of? So we did 3 analyses. The first one was by quantity. And by quantity, we identified that gloves were the main player, but personal protective equipment was the big family here. The second analysis was by weight, and again, gloves were the big winner and personal protective equipment. But we wanted to know more, and so we looked at the raw material of all of these different items. They are made of plastic, steel, latex, aluminum, paper, and all of these raw material have different impact on the environment. And so we needed to look at it, weight each of these items, the raw material, and measure the environmental impact of what we use. And what we found, these are the results, but again, the gloves were the big player and the personal protective equipment was the big family. And so the question was, what can we do? How can we engage healthcare workers to work and find a solution? And so the idea was to, and I make the link here with policy, was to engage with our infection prevention and control reference and propose a solution, because this item, gloves, are also the main player in high-income countries, in any healthcare system. So we inspired ourselves from the Gosh Hospital in London. They worked on the Gloves Off campaign, and we tried to adapt it to our settings, apply the methodology with a set of activities, audits, survey, communication, risk assessment, some activities. And the key message here was that no risk, no glove. But to identify the risk, we need to do risk assessment. So that was the key message that was brought to our teams. And the results, the first, sorry. Yep. And the first project where we worked in, we reduced by 40% the glove consumption. And the second project in Sierra Leone, very interestingly, very similar results, 40% reduction in glove consumption. And so beside all of the co-benefits, this really pushed our colleagues from the IPC group to implement this in all of our projects. Last year, we were really lucky because WHO pushed for the World Hand Hygiene Day and had a key message for the use of glove, the rational use of glove. And so we used that as an organization level to push 3 key messages. Was that hand hygiene and rational use of glove were powerful infection and control intervention. That glove never replaced hand hygiene. And we made the link here, the key link with the environmental impact of glove use. And that's where the result for the global impact was interesting, because we need the leadership engagement from not only the IPC community, but also the antimicrobial resistance group, the water and sanitation, nursing care, quality of care, health promotion, and the climate team. We made them work on a draft letter, a statement to encourage your colleagues to take action. This has been signed by all of our medical directors. And this message was brought to our different projects. And the results were, I would say, amazing. More than 20 projects pushed some key campaign from their own initiative in Tajikistan, in Afghanistan, in Sudan, in Chad, in Nigeria, DRC, Mozambique, Gaza, and I pass a few. And they were super inventive in the way they had to transmit this message. This is just a small selection, but they participated in the context, shared photos, videos, song, posters, games, even a poem, beautiful, from their initiative. So for us, it was really a really big win. And a co-benefit that I really did not expect is that every 8 years, the policy for infection prevention and control has to be updated. And this year, it was the case. And so from the work of last year, they were really sensibilized about the climate and environment constraint of providing care. And so it was included in the new update beside quality of care, patient safety, and antimicrobial resistance. It was important to align IPC practices with MSF objective towards climate and the environment and identify the key role of IPC practitioner to reduce our impact on the environment. And for me, it's a good case study to show that we can have a vision, we can communicate the result from the campaign, have a quick win, again, the campaign 40%, and this can be embedded into policies. And so now it's part of regular IPC activities to monitor glove use and to push for rational use. So 2025 was a very exciting year, and looking back at what we accomplished, 2026 is also very exciting. It's packed with surprise, but I'll keep them for next time. I just want to finish by saying I think what Lucy already shared before, but when we ask the people who they trust to tell the truth, politicians score the lowest and nurses score the highest. So everything we say and everything we do matters a lot and much more than we usually think. Thank you very much.
Thank you very much, and how a beautiful message to finish. I would like to thank all of the speakers and for sharing the knowledge, experiences, and insights, and also everyone who attended and contributed to today's session. and we are out of time. So if anyone has a questions for the speakers, just contact with the NNC team, and we will send the question to the speaker. Thank you all very much, and we look forward to seeing you in future sessions of the Planetary Health webinar series. Thank you very much.
Thank you.
Right.